The National Lung Screening Trial, conducted by the National Cancer Institute, was the first study ever to document a mortality reduction from lung cancer being detected early. The study enrolled individuals at high risk of lung cancer. We define that as ages 55 to 74, 30 pack years of smoking, 1 pack per day for 30 years, and if an individual had smoked in the past, we requested that they have quit only within 15 years because the risk of lung cancer falls after someone stops smoking. The Centers for Medicare and Medicaid Services have approved reimbursement for a lung cancer screening in individuals from ages 55 up to age 77. The U.S. Preventive Services Task Force has recommended screening with a grade B recommendation up to age 80. So many insurance companies will be paying for it now. It is important when discussing lung cancer screening with a patient to inform them about whether or not they're at risk for lung cancer and at high enough risk to benefit from the lung cancer screening with low-dose helical CT, and also to inform them of what the potential risks of the study are. One thing that does occur is that we do see a number of small nodules, particularly in the first study, that are the result of scarring or other exposures over the course of an individual's 65 years that are not really related to lung cancer. Those require additional evaluation. Frequently, that's another CT scan of the lungs. Rarely is a biopsy warranted, and we only had approximately 20 to 25% of our biopsies turn out to be benign. The other 75% were malignant. And we had a very low complication rate in the patients who either had a biopsy or an invasive surgical procedure. So although it's important to explain the drawbacks of the false positives, overall, the benefit of lowering your patient's chances of dying from a difficult disease like lung cancer really merits an informed decision-making process about the benefits of low-dose helical CT screening. And we discussed other issues related to it, and importantly, one of those is that in individuals who were still smoking at the time of their initial screening, those who we informed them that smoking cessation was available. We had approximately 30 to 35% of these individuals stop smoking and never start again. And if their screen was positive, we actually had a higher number of individuals stop smoking. So we think it's a teachable moment for smoking cessation, and this should help lower other causes of death, like heart disease, and we think it's a very useful test overall. And so we encourage an evaluation of a patient's risk for lung cancer and an informed decision-making, which Medicare will reimburse this additional interaction and the informed decision-making process, which will be quite helpful. And these studies should be done at an American College of Radiology approved facility because they have a registry that Medicare has approved to record all of these information and make sure that these exams are being done to a high quality so the maximum mortality benefit can be achieved.